we are here this morning to address how do we protect our future generations. A very apt theme, very timely theme, very relevant to the crisis that we have. But again, if I may reiterate, it's very important to protect the current generation before we move on to the future generation. Okay? Because our burden, the burden of this disease, we cannot pass it to the future generation. The healthcare needs of our country will very much depend on this generation. And as rightly mentioned, the crisis. It's a man-made crisis that we have in Fiji. And we all need to put all hands on deck to see the best solutions and the best way forward. And again, yes, very important to focus on our children, because children are very, very powerful. They have the power to change probably our mindsets as well. As mentioned, children dictate what they eat. Children can dictate what's being put on the table. And that's where parental responsibility comes on. I think we live in a society with a mindset that a lot of blame can be shifted. And in this case, a lot of blame is normally shifted on governments, NGOs and other stakeholders, especially when it comes to education and health. Well, shift it on the health ministry. Shift it on the education ministry because they are not doing much. Where are the parents? Breakfast is provided by them, lunch is provided by them, dinner is provided by them. The lifestyle that the children go through is the responsibility of the children. We can do only so much. So involving the parents in this this campaign that we have to protect our future generation is very important. Now, coming back, I get carried away, Mr. Bure, because of you I got carried away. So ladies and gentlemen, indeed, it's indeed an honor, and on behalf of the Ministry of Health and Medical Services, I'd also like to welcome you to this Health Promoting Schools Forum with a focus on healthy diets and physical activity, water and sanitation, soil-transmitted helminthic worms, and mental health and well-being. I'm sure you all know, you're experts, that good nutrition is vital for good health, especially for healthy growth, for disease prevention, and for mental health development of young children and adolescents, and of course adults as well. Undernutrition is a serious concern among our children, as it interferes with their growth and development and predisposes them to health problems such as infection and chronic diseases. Child undernutrition is the underlying cause of 35% of the disease burden in children under 5 years, and that contributes to about 1/3 of all child deaths globally. Stunting, I'm sure you know, refers to having low height for age compared to WHO child growth standards, and is a key indicator to chronic undernutrition among infants and young children. In Fiji, stunting affects almost 1 in every 11 children under the age of 5. Another indicator, wasting, refers to low weight for height. This symptom of acute undernutrition results from insufficient food intake and is compounded by a high incidence of infectious diseases, especially diarrhea. Almost 2/3 of children aged between 6 and 59 months have micronutrient deficiencies like anemia caused by insufficient intake of iron. Those high numbers should raise a red flag in Fiji for us, as undernutrition could become a serious public health problem unless appropriate interventions are introduced. And I'm sure your forum will be able to provide some appropriate interventions that need to be undertaken. Other factors, ladies and gentlemen, like water, sanitation, and hygiene also play a fundamental role in nutritional outcomes. Parasitic infections, such as soil-transmitted helminthic worms, are caused by poor sanitation and hygiene and can lead to anemia and also reduce physical and cognitive development. They infect around 2 billion people globally, and since 2012, Ministry of Health and Medical Services has provided deworming treatment, weekly iron supplements, and vitamin A to infants, young children, adolescents, and women of childbearing age through a mass drug administration campaign supported by WHO. These low-cost interventions have proven effective in addressing some basic nutrition issues. The Ministry remains committed to working with partners and donors in our effort to achieve a better nutritional status for children and youths of our country. Like they say, the journey of 1,000 miles begins with a small step, and in this case, through the activities of the Health Promoting School program, the goal of this project is to support the government of Fiji in its effort and commitments to improve the overall health of school-age children. Some of the planned activities will include: 1, monitoring of school health services at the school level, establishing an effective supervisory system for health promoting school implementation, engaging communities in decision-making for health promoting schools activities at a school level. Communities will be empowered to monitor HPS implementation as an integral part of the support system created at the school level. Regular meetings at the school level with representations from surrounding communities to discuss comprehensive packages and services for these schools. Ladies and gentlemen, the Health Promoting Schools program in Fiji is part of a Healthy Setting initiative by the Ministry of Health, which has been strengthened by the establishment of a link between the Ministry of Health and Ministry of Education. As a result of the Memorandum of Understanding and Support by Development Partners present here this morning, dedicated officers are based in each ministry to coordinate and facilitate the implementation of this program. In order to more effectively focus on the priority areas within Fiji and to streamline the support provided for HPS, 3 priority areas of focus have been identified, namely diet and physical activity, which includes canteen, healthy eating, physical activity, and related environmental issues such as active play areas. Now, coming back to canteen, the year in which I started last September, actually, with the Ministry of Education, we launched the canteen guidelines. And of course, policies and guidelines and plans can be launched, but it really needs to be translated into real activities, practical activities to ensure that we meet the whole rationale behind such policies. Many a times policies are done, and sometimes they're just left on the shelves to collect dust. So the Ministry of Health and Ministry of Education officers are involved in ensuring that the canteen policy or the guideline is strictly followed. But again, like mentioned, children, the meal that they have in school is probably just one, but what they eat within that school hours is also very important. A few people have also raised their concerns about what happens when the child leaves the school compound. We might have a school canteen policy, we might be very strict about what school canteens are selling, but what happens when they leave the school premises? Okay? What do? Of course, they are free to go and buy whatever they want to buy. So this is where we have the parental involvement coming in, the values that we teach our children, the focus that we place on the health of our families. It's all about changing mindsets. And I think as adults, as parents, it is our responsibility to ensure that that discipline regarding health is inculcated in our children from a very early age. Otherwise, we will continue to have forums such as this, we will continue to have programs, we will continue to invest money into such programs. But if that mindset doesn't change, then we'll have a big challenge in protecting our future generations. So as adults, as parents, I think we need to emulate the behavior that we want our children to portray. So parental role, again, if I may emphasize, parental role, family responsibilities is very important in trying to change the mindset of the generation that we are trying to protect. The other priority area, ladies and gentlemen, is water, sanitation, and hygiene, which includes access to safe drinking water, appropriate toilets, hand washing facilities, school environment cleanliness, prevention and treatment of helminthitis, and control of other communicable diseases. We had a discussion some weeks back with my permanent secretary, and we said a lot of infections could be controlled or avoided if people practice simple hand washing practices. And again, that is something that can be practiced within the homes. Okay? Every child, every individual must ensure that you wash your hands, the wash program. But again, how it translates into real actions within individuals, within families, within organizations is something that we have to monitor. So basic hand washing practices are also very important. Mental health and well-being also is another priority area, which includes mental health issues, sometimes which includes bullying in schools, within communities, depression, use of substances such as alcohol, tobacco, and drugs. It will also include issues such as violence and self-esteem and links with sexual and reproductive health. So it's a holistic approach to ensuring that we bring to focus all these issues. The project will include 204 health promoting schools. Of these, 161 are primary schools and 43 secondary schools. The project, of course, is going to target more than 44,000 children between the ages of 6 and 13 years, primary school, and almost 20,000 adolescents between the ages of 13 and 17 years by 2019. The total number of direct beneficiaries of the proposed project is targeted to about 64,000 students. And you can imagine the 64,000 students, when they go to their communities, of course, the target audience is also going to increase. So considering the impact this is going to have on the children and their parents and the communities that are associated with the children, we expect 100,000 beneficiaries directly or indirectly towards this program within surrounding communities, and 2,000 teachers will be involved to improve the capacity in managing these school health programs as a result of the training and other interventions that will be provided. So ladies and gentlemen, I wish to sincerely thank the Korean International Cooperation Agency for the support in funding this highly important project in Fiji. Thank you very much. We'd also like to thank WHO for helping coordinate the various activities of the project. And I'd also like to thank all the staff from the Ministry of Education, the officers from the Ministry of Health, and other partners that will come in board to ensure that we give this project a success. So I definitely look forward to learning of the impacts of the project and the impact it's going to have on the health of our children in the participating schools, their families and their communities at large, and how best we can further expand to ensure that every child is covered in the 902 schools by schools across Fiji. So on that note, thank you very much. Please relax and have a fruitful and an enjoyable discussions. And Mr. Bure, do you think I should put a scale here during recess and lunch break? I mean, it's so mentioned, big is not beautiful, but whatever that is. Please, like I said, do care for your health as well. Your health is important, your family's health is important if we are to proceed with addressing the health needs of our country. So thank you very much, and thank you again for the opportunity to be at the launch of this important project logo, and the Ministry of Health and Medical Services stands ready to support and partner with you in ensuring that we achieve better health for all our people. So God bless you. Have an enjoyable day. Thank you.